Thank you very much. And I want to ask just a few other questions before we start to wrap things down. We got room for another question or two before we wrap things down. Knowing that breast cancer is the most common cancer among American women, what is the role of public health? You know, we think about efforts that are out there, initiatives. There are a lot of foundations that are out there, social media groups. You know, what's the role of us as healthcare providers within a bigger system of public health in order to try to help diagnose and defeat breast cancer? What is the role? Like whether it's like at the role at the local level or the state level, what should we be doing? What's public health's role? Dr. Govitas?
You know, I think consistency, just a consistent answer to people's questions. 8-9 years ago, there was a lot of controversy regarding breast imaging and this breast imaging task force that came out with confusing recommendations.
Was that when they said start at age 50,
start
something
at
like
age
that?
50
Yeah, I remember
and go
that now.
every other year, and that just gave people who already don't want to come in for a screening mammogram an excuse to not come in. And it is so disappointing when you see a patient who skipped a year come in and they have a more advanced tumor than they normally would if they didn't skip a year. And just a consistent message from primary care providers, from the government in general, that just like we all know smoking is bad, right? Any reputable source is going to tell you it's not a good idea to do that. We need consistency in that at 40 years old, you get a screening mammogram.
Excellent.
And you do it till death.
And
You know, there's no end point.
Yeah.
We don't have an end
Tell my
point, and
patients,
just
like,
continue to
keep
do
it
so.
going.
That consistent message, so people can't hum and haw and come up with an excuse or create their own barrier to coming in.
Dr. Gressy, you want to give a commentary about, again, what's the role of public health in this whole thing, where we fit as physicians, where we fit as just people, human beings? What's our role for each other for breast cancer?
I definitely believe that the government, state legislation has a huge role in this. The American Cancer Society has a Cancer Action Network, CAN they call it. And basically it is looking at these breakdowns by counties, individual, looking at screening rates and sort of saying, is this an access to care issue? Is this a financial issue? Is this what are the barriers there? Is it an education issue? And not only having the state legislation, but perhaps nationally, things set in place so that every person has an access to get early screening if they choose to do so.
Excellent. Well, we got about 5